So my name is Nicholas Rodriguez, and for my microbiology microbe presentation, I did Influenza A. I think we all know what this virus is. We've all had it before, known someone who's had it. It's important because it infects a lot of people, and it has an outbreak at least every year towards the end of the year. And as future nurses, I think it is important that, because we're going to see it, I think it's important that we know how to treat it and what it is. For my introduction, Influenza A is one of 4 strains of influenza, a respiratory virus that is very contagious for humans and animals such as pigs and dogs, and also cows. It causes seasonal flu outbreaks and pandemics. It also has very different subtypes because it has surface proteins, H and N, that play a key role in how the virus infects cells. Influenza is highly mutative, and it also has these subtypes. The main subtypes are H1N1 and H3N2, which are the annual influenza outbreaks. And it has many more, but as you can see, like in the graph, it shows that the main ones that cause the influenza outbreaks are the majority, and the other combinations just, they have a low rate of infection. So for classification and structure, the family is Orthomesoviridae, which includes influenza A, B, C, and D. The structure is an envelope negative sensed RNA, and it has surface glycoproteins, hemagglutinin, and neuraminidase, which is the H and the N. The HX is the key that binds to receptors in respiratory cells, while the N cuts the virus from the host cell's surface after replication to infect the host and spread the disease. Classification, there's many different types of H and N. They range from H1 to H18 and N1 to N11. So there's many different types that there could be. The higher you go up, like let's say you were at 18 and 11, it determines the severity and contagiousness of the virus. So it could be more contagious and higher severity, higher mortality rate. Habitat and transmission. It's very common to other viruses. Normal 3 types of transmission, which include droplets, aerosol particles, and surface contaminants, which is why it infects so quickly and through a population. Transmission comes mainly through talking, coughing, and sneezing. Adults can infect 1 day before symptoms onset, so during the incubation period, and will be contagious for about 5 to 7 days after symptoms begin. Influenza A viruses have a natural reservoir in wild aquatic birds, making their eradication almost impossible for us. So just the mutation and where they come from, it's so hard for us to just battle it, I guess. So pathogenesis and signs and symptoms. It targets the upper respiratory system and causes inflammation of the upper respiratory tract and trachea. The immune reaction to the viral infection are responsible for the signs and symptoms, which include high fever, body aches, chills, fatigue, and may cause pneumonia. But I'm pretty sure we all know those signs and symptoms. For virulence of the microbe, both surface proteins, neuraminidase and hemagglutinin are key for neutralizing antibodies in the host, so they combat the host. For diagnosis and treatment, normally when you go into, to see a nurse or the doctor, they're going to give you a rapid test and PCR, which are highly sensitive to the virus and will give you an accurate reading on if you're positive or not for the virus. It also is very quick, in about 15 minutes. There's also antiviral medications that we would only normally give in the first 48 hours, but you can give it after, just to treat symptoms and help with fatigue. These medications are Tamiflu and Sofluza, which inhibit the virus's ability to replicate in the host. So they bind their H and N protein, their surface proteins, so they can't attach to the cell and replicate. The annual vaccinations, while the flu vaccine is not 100% effective, it lowers the intensity and duration of symptoms in most people, and a lot of older people, it's also probably worth for them to get the vaccine because it probably helps them more. But for treatment, really just antiviral medications and rest and fluids. For my last slide, I just was going to talk about mutation in influenza. There's two different types of changes: antigenic drift and antigenic shift. Drift is minor changes in the H and N proteins. It means that the antibodies from vaccination or plasma cells from our body, which give off antibodies, are ineffective. And also antigenic shift. It's major changes such as switching of H and N genes between like human H and an avian H, which can create a new virus that can become can have high mortality and become a pandemic. But H1N1 and H3N2 are the annual influenza outbreaks, while some others can be H5N1 and H7N9, which are avian strains of influenza, such as the swine flu with high mortality rate. And then here are my references.